Ah, there's the red button.
Mhm. So this is Ben Gillespie interviewing Lenore Chinn at home in San Francisco on July 30th, 2020 for the Smithsonian Institution Archives of American Art Pandemic Project. Lenore, as a retired public health worker, how have you experienced the health crisis of 2020?
For me, I draw parallels between what I witnessed as a healthcare worker, I would say in the early 80s when we had HIV and AIDS sweeping through the GLBT community. And at that time, a lot of people who were not part of that community thought that it would not impact them or there was nothing to be concerned. And also in those days, very early on, it was thought that it was something that hit primarily gay men. So that was another issue of misunderstanding in the general public. And at that time also, when we look back at parallels between then and now, there was a woeful lack of adequate response from the government at any level to the seriousness of this pandemic. And there was a lot of misinformation about the disease itself. And of course, we knew more as we went along, but also it didn't help when we had people who had some serious homophobia going on, spreading misinformation about how you could get it by, for instance, maybe riding an elevator with somebody or, being in the same airspace, breathing next to somebody, sharing utensils at a restaurant, or it was just wild misinterpretations. So there was that addition. And there was a lot of anxiety about, how fast it was spreading. And of course, the public policies were very shaky around that. And adding to that was, the reaction that we needed to close down the gay bathhouses. And that was a whole other issue because, you had the owners who, had difficulty understanding that there needs to be some compliance or at least some form of education, and there seemed to be some reluctance on that part. On the flip side, you had people who were knee-jerk reaction, let's just shut everything down and all of that. And so that created a whole set of other issues. And it was quite a few years before any kind of medical treatment became available. But that doesn't mean that it's over because there are still people who are sick. In my personal life, after a while, I lost count of how many passed on. It was essentially serial loss in our community on a grand scale. But today's epidemic, the tragic part is it's invisible. Back in the day when we saw people who had gotten the HIV/AIDS, and when they got really sick, it was visible when you saw people out walking around on the streets or walking with canes or being, pushed along in wheelchairs, and as their health became more dire, it became more apparent. With this pandemic, unless you are working in a healthcare environment where you're confronting it day to day, or you have somebody in your personal life who has been impacted by, being tested positive and then getting sick and that kind of thing, you don't see it. But as a former healthcare worker, I still get information from some of my friends about what they're dealing with, the level of stress, the frustration with the parts of the public that refuse to wear masks or think it's no big deal or it won't affect them. Some think that, it won't affect them because they're younger or they don't have pre-existing issues. And so therefore, if they do get sick, they'll just go to the hospital or whatever, and they'll get treated and they'll recover. Well, they don't really know what recovery means. You know, I mean, there could be long-term significant effects. And that's not something that you really want to have to deal with if you can avoid it.
Right. And especially a crisis that we're seeing alongside other racialized issues in the US. And from San Francisco, and as a public healthcare worker involved in activism for racial justice, and more broadly, how have you witnessed that unfolding, and how has it influenced your own experience of COVID-19 and life in America in 2020?
Well, you know, what it's really forced a lot of us who are in communities of color is to remember that while we're seeing a lot of, you know, horrible things essentially coming out of the woodwork, no thanks to our administration at the top, what it's done, especially in populations where there are significant groups of Asians, like San Francisco, New York, and, you know, any metropolitan city, but even some of the smaller towns where there are, you know, there are Asians there. What this has caused is a lot of an escalation in anti-Asian violence. Anything from verbal assaults on the street to downright beatings. Like, I think it was about a week ago, there was a bus driver, one of our Muni bus drivers was beaten while he was on his bus because, I think it was a man, because he had asked 3 people who had boarded to put on their masks, and they refused. And instead, they began spitting on him, hurling verbal assaults, and then they took a miniature baseball bat and started hitting him with that. Well, some days later, it came out that that bus driver was Asian. The person has not been identified, nor did they identify the 3 people who beat him, and those people, I think, got away. But that's just one example, you know. And so, you know, initially when we were starting to hear about COVID-19, the one example of a response was that the Chinatown community got together very quickly, and through the Chinese hospital and their media and local and neighborhood leaders, they were able to get on board with the recommended guidelines. And so even though they had already taken a heavy economic hit, they went with the idea, and they, you know, it wasn't hard to convince this group to say, this is what we need to do. Part of it, I think, is also they remembered what happened with SARS in China. Whereas I noticed the rest of the city was slower to come on board with taking those guidelines. And, you know, in addition to the anti-Asian stuff going on, there was also the, you know, I mean, we already had the anti-Muslim thing going on. I mean, everything since 2016 was just a downward spiral, but now it's all converged. The positive note is, if there is one, is that some of these communities have come together to offer mutual support. Like the Japanese Americans were really quick to come reach out to the Muslim and Arab American communities in solidarity because of their history during World War II being interned. So there's positive notes in this narrative.
Right. And it feels like a parallel between the HIV/AIDS crisis and the current COVID crisis, that it really foments a fear of one's neighbors. And in a time where we're all feeling so isolated, what are you doing to find community?
Well, some of us, especially in the creative community and various other communities that I move in, we've just sort of transitioned to doing, more online Zoom presentations or Zoom interactions. Like yesterday, I had one with a core group of about a half a dozen Asian Americans who are artists of one sort or another, and so we share, some of our family histories, what they went through. Like one Japanese American showed images that I'm sure will eventually go to the Stanford archives because she had pictures from when her parents were interned and even prior to that. I think her parents actually met in internment, which was kind of interesting. And so I think that really speaks to the importance of documenting these historical events and everything, because they really are history lessons that are important, not just for now, but for future generations. So we talk about all of those things and also the kind of creative work that we're, doing now and sharing all of those things. But as elders, I think we're seeing how important it is to pass this information on to the next generation.
And in terms of passing down that information, your paintings and your photographs are so concerned with self-affirmation and preservation as restorative forces for a community and as a means of staking a claim to an identity in the face of incredible adversity. And how do you feel your own work changing during this time?
Well, time will tell, but I think because I'm now doing more digital photographic work. I mean, I transitioned from painting to photography. It was a variety of different reasons, but I just sort of ran out of room in my studio and it became impractical. Plus, because my painting, my income from my painting was rather sporadic. That's one of the reasons why, healthcare was very good for me, because it subsidized my art profession. But I would say over the last 10 years, I began to transition more to photography, which was always part of my art practice. But now, I'm more literally focused on that. Prior to COVID-19, I was doing a lot of street photography, or I was attending a lot of cultural events or political gatherings, things like that. So in a sense, I've become sort of a chronicler of our times as it relates to the communities that I'm involved with or interested in. That kind of came to a grinding halt in early March. I stopped taking public transit because I thought, well, anytime I would catch a cold or something like that, it was usually because I had written, on Muni coming home. And then when it became apparent that it's coming to California, one of the first things that one of my doctor friends had recommended, and it turned out he was a gay man who had treated my dad when my dad was quite ill. My dad's gone now, but Greg Oxtis was the geriatric neurologist who treated my dad. One of the first things he said is, stay out of enclosed places, wash your hands, wear a mask, all of the things that have become a mantra. And so I began to take that more seriously as time wore on. I haven't been to a Safeway or a Costco since probably early March. I usually go to a little mom and pop supermarket, grocery store, which was temporarily closed, and then they reopened, and they kind of reconfigured it so it's a little safer. We all wear masks now. And so I was really hunkered down for those several months until Juneteenth. That was when a Japanese American friend of mine, who she and her sister spent some years in an internment camp. She said, well, the Japanese elders have been invited to join the African Americans at the African American Art and Culture Complex because they're laying a second layer of paint on the Black Lives Matter that they had put in the street, and it took up 3 long blocks. Well, it come to find out it was actually organized by friends of mine, so that worked out really well. And I thought, gee, I wonder if I could go over there. It's outdoors. I could kind of scope it out from a hill and see if it looked safe. And it was. I had my gloves, my hat, mask, and all of that. So I went down there. I took a lot of photos. It was good to see my friends there, you know, and we're all in our garb and everything, and in our community, and doing something we felt was important and affirming. And it's interesting that over the years, you know, prior to all the upheaval that a lot of people, white people essentially, got really freaked out about the Black Panthers. Now, some 50 years later, we're celebrating the movement that people refused to acknowledge until George Floyd was murdered, you know. So, and the second thing that I went to was a Japanese in solidarity with BLM in Japantown. And the third thing that I went to, and this was the last thing I went to, was in June, on what would have been the day of our Pride March, which was canceled. Some friends of mine organized a People's March, and it followed the original route of Pride from 50 years ago. And so it was organized by Alex Yuen and assisted by the transgender community, and they came down Polk Street from Washington and had a rally at City Hall, which was pretty well attended. And so I stood back with Rick Gerharder, who's a local gay photographer, you know, being sort of the elders in our community. Instead of being up front at the stage where we probably normally would be, we were on the lawn taking pictures from afar. So that felt safe, you know, because we could do what we wanted to do from a distance and still be witness in that way. So that's what I've been doing.
Those are really amazing moments of intersectional solidarity amongst communities. And I'm very glad you've been able to safely participate in those. And just by way of wrapping up, could you tell me a little bit about your specific hopes for the rest of 2020 or moving into 2021 for your own work and for the communities you're involved with?
Well, one, I hope we send a resounding defeat to number 45 and his cronies. I mean, that would be wonderful. We shall see. We really need to turn out the vote. But I think a lot of people, especially a lot of young people, are pretty fired up. So I'm hoping that the campaigns can strategize and get behind Biden, even if he might not have been our first choice. I don't think we have a choice, and we can't throw this vote away. You know, now is our chance to, you know, rise up essentially and do something in that way. In my own work, it would be nice to get out and about a little bit more. I haven't even gone to any of those outdoor restaurants that are, you know, I still am not comfortable with that yet. And eventually, I would like to get back on track with my limited travels. I had to cancel my trip to Hawaii, where I normally go, because my brother and extended family live there. And I just felt that, one, I don't want to get into a lift at this time, just getting out to the airport, much less an airplane. And then in addition to their initial travel ban that they implemented, they also had a 14-day quarantine. And so I thought, well, there's no point, even if I wanted to go through all those other risks, to jump from the frying pan into the kettle or vice versa. You know, for me, I think I'm glad that I was able to do the things I was able to do prior to this. I was in a big Art After Stonewall show that started in New York, and it traveled, and I was able to fly out to New York for the first time in decades. So that was great fun, and it was a great celebration. That was another 50th year anniversary or whatever. So we'll see. a lot of people are saying, well, we want to, you know, be able to resume some of our freedoms. And some are also saying, we don't want to go back to the normal we had before because that wasn't so rosy either. You know what I mean? I think if anything, I hope that this will give people an opportunity to reimagine how we want to live moving forward and what things that we might be able to do to reconstruct public policy and maybe how we reimagine safety issues and where the social worker might be more important to integrate into these ideas rather than entrusting all of our resolutions to having the police come out and try to handle things that they're not well prepared or trained to deal with. You know, I just want to hope for a better world down the line.
Yeah, well, thank you very much for speaking with me today, and I really hope that you get to have some beautiful and safe celebrations in the near future.
Thank you.